Okay. Well, welcome to my presentation here. My name is Lisa Jordan, and I am one of the assistant professors here at WVU in the biomedical laboratory program, diagnostic program. Forgot that word. I know that is quite a mouthful, but it really encompasses everything that we really are. And so maybe you're wondering what is available at West Virginia University. I hope that you're planning on coming, but I also wanted to let you know what we have if you're interested in the medical field. There are many careers that are in part of the medical field. A lot of people think that you just have to be a doctor or a nurse or an EMT. But I'm here to tell you there is a lot more to choose from. And there's some, now if you really don't want to spend a long time in school, then probably being a physician isn't the path you want to go, okay? If you're one of those ones that you want to help people, but you really don't want to be one-on-one with patients and take care of them, then probably you don't want to be a nurse, okay? But if you're one of those people that love to help people, but really, would rather, you like the science behind it, but you want to, but the medical field interests you, then I would like to encourage you to think about the medical laboratory. And we have a couple tracks that I'm going to talk about, the clinical and the anatomical. And then I want to take you along on a journey with my imaginary friend, Bob. Now, as you can see, I got a car down here at the bottom of my screen. Of course, Bob loves muscle cars, as do I. There's a connection there, right? And nice Chevy down there. And he also likes the beach. And I had to, put a beach picture up there because I like a beach too. And right now, that's just pretty much where Bob's at. Now he realizes, now he's a senior this year, and he knows that next year he's going to have to make a big decision. Where is he going to go to school at? Well, he's already made that decision. He wants to come to West Virginia University. But what is he going to do? What's his major going to be? And if you're a freshman and you're looking at this, then you got some time to explore and think about this. And I hope this video helps you. So here's Bob. He knows he needs to make a decision, and he just doesn't know what is involved. Now, keep in mind, on TV, the only thing in the medical field you will see is being a doctor, a nurse, or an EMT. That's all their TV shows are about. But there are so many more behind the scenes, okay? So what are the medical professions in the hospital? Well, Bob, like everybody else, thinks that there's only the big three, right? And they're the only ones he sees on TV, so that's the only ones. But there are more, I mentioned. And Bob is going to experience this, my imaginary friend, is going to experience this, and he's going to realize there are more careers out there, and the help that he received came from people he had no idea existed. So here's Bob. He's texting and driving. Actually, he just picked it up. The phone beeped at him, and he just glanced down just for a second. It just really was a second. And what happened afterwards changed his life dramatically. He got hit by a truck. He went through a stop sign, got hit by a truck. You could see how the front end just smashed right up in there. So he got hit pretty bad. And then he was rushed to the emergency room, as you can see. While in the emergency room, he met his doctors and his nurses for sure. And he ended up puncturing his spleen. And this is fairly common in car accidents where the ribs get cracked, or not more than cracked, they get broken, and they go in and puncture the organ underneath. Hitting the steering wheel, maybe the seatbelt wasn't on, or just plain maybe it was such an impact that he just ended up getting crushed. Your spleen sits behind the stomach here. You can see the stomach right here, and the spleen sits right behind it. Here are your ribs, okay? Here's your stomach right here. It's a big J tube here, and it goes down into your intestines. Well, the ribs then break, and then they puncture the spleen. What the spleen does is it filters blood. It's one of its primary functions is to filter blood. And it's one of those situations where if it's not taken care of very soon, you could bleed out into your abdominal cavity. So you'll have internal bleeding, and it's fatal, okay? Doctors, like they do on TV, they hollered for lab stat, right? Well, this doctor kind of said CBC, complete blood count, BUN, creatinine, type and cross for 4 units. That's for the blood bank. Now, in most cases, they have their own stat protocol. So if you were in a car accident, they have their own protocol. They know that all the doctor has to say is lab stat. And then also, and this doctor also mentioned to get him to surgery. Okay, excuse me. Well, who works in the laboratory then? Do the doctors? No, I had to move my face down there a little bit. Just covering up my doctors. So no, the doctors, medical doctors don't do the testing in the laboratory. Now we do have doctors called pathologists, and they're in the laboratory, and they review the results, any abnormal results, and they kind of like have the final say if there's something really wrong, that needs to be evaluated. Other than that, all testing is done by the medical laboratory scientist. However, a lot of people think the nurses do the lab testing, and the nurses don't do the lab testing. Neither do the medical assistants, which I don't have them on here, but they also don't do the testing either. So who does work there? Okay, now keep in mind, at West Virginia University, we do have a nursing program and med school. So, if that's where you want to go, I mean, that's a possibility too. So who does the blood drawing? Well, in the emergency room, in the case of what happens to Bob, and again, move me up there so you can see my friend down there. In the case in the emergency room where Bob was at, his situation was so severe that nurses will start an IV and they will draw blood drew blood from him. Now, in cases if he wasn't in a very bad situation and they had time, then they would call a phlebotomist to come down and draw the blood. Who are the clinical laboratory science professionals? Well, I'm introduced you to one already, a phlebotomist. They collect blood. I don't know how many of you had your blood drawn, but here's, they cleanse the site here, and you have your barrel and your needle there, and then, it's uncomfortable. It really, it doesn't hurt. It's just uncomfortable. And then you have all these different colors of tubes, and what they go to different areas of the clinical laboratory, okay? So different tests are done on different types of tubes. What is a phlebotomist? Here's some statistics about a phlebotomist. Well, you can make about 35,000-ish, depending what part of the country you're at, what size hospital you're at, whether you work in a physician's lab or not. Many have a year's certificate. You can go to a technical college and get a year's certificate. However, most train on the job. Most are taught on the job. Medical, we don't have that program here though. Medical laboratory scientists, those are the people that work in the laboratory, and actually this is what this guy down here is doing. He works in the laboratory and he does the testing. He releases the results, he does the testing, releases the results, and he makes $53,000 a year. Granted, depends on what part of the country you're at. It determines how much you're going to make. Also determining, again, if it's a small hospital or a large hospital. Now, I want to point out, how many degrees do you know that you can actually get a job before you graduate from college or from the university? I can't think of too many, all right? Our students, quite a few of our students at WVU in our biomed program, they had jobs before they graduate. So talk about like 100%, I won't say a guarantee, but there's a high percentage that you will get a job. The job outlook is very good. They desperately need medical laboratory science people, okay? Here's a website down here if you're interested in looking into it further. It's from the Bureau of Labor and Statistics. Let's talk about the blood bank, okay? Remember when I mentioned type and cross for 4 units? Well, first of all, we have to type the patient's blood, okay? So I don't know, do you guys know your type by any chance? Do you know what blood type you are at? I happen to be an A, and of course that happens to be Bob's blood type. And basically it just means that he has a sugar on his blood, red cells, that is an A. And I guess that's the easiest way a basic way of describing it to you guys. And then there's a B, sugar, okay? AB is both together, and O means that there's no sugars, at least of those types, on the blood cell, okay? So void of sugars, okay? And you inherit these types from your parents, okay? So if you have an A and your mother's an A and your father is an O, you're going to either be an O or an A, depending on how that transfers. But you won't be a B, okay? So if you are a B, then you might want to wonder, but anyways, that's the blood types, okay? So that typing, we want to see what what his blood type is first, and then we match it to a unit. Over here to the left is how they, one of the ways that they type and cross-match blood. They add the patient's red cells up here, okay? They have reagents they add, but we won't go into detail on that, okay? And they spin it down, and if the blood clots or if it's a positive, then that blood will stay up on top and won't go through the gel. And that's how they determine if it's positive or negative to whatever type. That's a type. Then a cross match, and these are units right down here. 1, 2, 3, 4. These bags right here constitute a unit of blood, okay? And it takes Bob's blood, and they mix it, with segments or a part of this blood, and they see if it's compatible, or they see that it won't be a positive reaction, so it won't clump, okay? And then that's the type they'll give. Now, if he is an A, which he is, he would be the recipient, okay? And he can get either O, because it doesn't have any of the antigens on it, or he can get A. But he cannot get B, and he cannot get AB. And if someone doesn't do their job properly, then he will die probably within 15 minutes, depending on how much blood he has gotten. So in this area of the laboratory, you have to be very fast, okay? Because if you're slow and they don't get the blood, Bob will die. If they're fast and they don't give him the correct blood, he will die, okay? So this is fast and 100% accurate every time. And I guarantee you, after you come through West Virginia University's lab program, you will definitely you'll be confident to know that you will be able to type and cross-match units. And I also want to put in a note, plug here for the American Red Cross. They desperately need blood. And please consider, there is no substitute out there for a person's blood cells, okay, for another person's blood cells. There's no substitute. And it is the gift of life. There is none other that will can take its place. So consider that if you can, it will save somebody's life. If you want to do something right now, that will save somebody's life. Okay. Then another area where Bob's blood went to is called a CBC, okay? And it's a complete blood count, all right? Now this area is called hematology, and you can see all the tubes lined up here. The analyzer has a probe right here where my cursor is, my pointer is, and that probe comes out and it punctures the tube right there. It takes a sample of the blood and then gives a many array of results. One of which is how many red cells are present in the blood. Okay, it will tell you how many white cells you have. All right, and that's all from the analyzer. Okay, now when they look at the blood under the slide, they'll see all these little pink guys right here. Well, they're red cells. Okay, and I don't know if you're aware what red cells are. But what red cells do is that they upload oxygen from the, use a little computer talk here, upload oxygen from the lungs and take it to the tissue, and they basically download it then to the tissue. All right, and it's due to partial pressure. Then while they're there, they pick up some some CO2 rather, and they take it to the lungs and offload it, and you exhale the CO2. That's what the red cells do for 120 days. Okay, and then after that, they're gone, they're dead, right? The spleen takes care of them. Well, Bob's got some problems with his spleen. But here's normal. You're looking at the graph here. This is what a normal volume of blood would look like. Here would be red cells. And up here is the fluid that would be in your blood, because you have to have fluid to move the red cells around, right? So that's that fluid we call plasma. But anyways, that's what that looks like. Now notice the red right here is a lot smaller than this over here. And that's because Bob has lost half his blood. He doesn't have too much liquid left in his blood either. Okay, you can see that yellow is down too. I want to point out this one. Some of you gals out there might be anemic, and you might know already you need iron, and iron is necessary in the bone marrow. What the bone marrow does, it makes red cells, okay? And it can't, okay, it can't if it doesn't have iron. Iron is a necessary ingredient for making red cells. If it doesn't, then it does the best it can with what little it has. And that's why you'd get just a little bit of red cells right here. And that's why you're feeling really fatigued, okay? Look at on this area here on this slide is looking at this cell here and this cell over here where my pointer is. This cell right here is what we call a neutrophil, and it increases when there's a bacterial infection. So when we look at a slide, we can tell if somebody's has a bacterial infection. That's pretty cool, right? Or we look at this cell over here and we can tell if it's increased, we can tell that they have a viral infection. And of course, now this year, we're very concerned about viral infections. So we should see very much an increase in these lymphocytes, okay? This is called a lymphocyte. There's little purple spots around here, and that would be what we call platelets. They're not really cells. They are a part of a big cell that kind of gets slushed off in the bone marrow. But once activated, these little guys can form clots. Now that clotting is pretty good if you have a break in the skin. Of course, you want to clot, right? But when you have AFib or your heart rate is kind of not regular, your blood tends to pool in your legs, and for some reason, these little guys get activated, okay? And then they form clots themselves inside your veins, and that's why they call it deep vein thrombosis. You've probably heard of that, or embolisms. And when it goes to the lungs, then you can die. So So that's a whole nother area in itself. Leukemia, if you see an increase of this one, or if you see increase of this one over here, or basically you see an increase in the red cells, that could be leukemia, and vice versa. If you don't see these cells right here, or too much of these cells, it could be leukemia as well. So either or on each side, you have to have a certain balance. You know, too much is not good, and too little is not good. You have to have the right amount, and if not, you have problems. Another area that Bob's blood went to is the clinical chemistry area. And here we have these big analyzers. There's a lot bigger ones. I've seen a lot bigger ones, but it's about all I could find a picture for. But you load the specimen or Bob's blood on here, this big robotic arm right here. You can see it right here. This robotic arm comes out, draws up a sample, takes it over to this wheel over here where it performs a reaction, a chemical reaction. The chemistry behind it, it looks very similar to this, but in Bob's case, we want to know what his BUN is, his blood urea nitrogen, and it is a byproduct of metabolism of proteins, okay, and creatinine. Now, you guys that lift weights, you're probably very attuned to creatine and muscles, and not that I advocate taking creatine, but you do know, most weightlifters I know are very well aware of creatine in their muscles. So, but the byproduct of that metabolism of the creatine is creatinine, okay? The kidneys then function as to filter the blood, okay? Actually, they filter the blood to get rid of all the waste, all right? They don't necessarily filter it like the spleen does, but they have a different function, and not a different filtering function, so to speak. And when a patient is in shock, then the kidneys shut down, okay? And there's other things that cause the kidneys to shut down, but one of the things is shock. And your BUN and creatinine are what we call kidney function tests. And when they are increased, that means your kidneys are not working. And your kidneys aren't working if you are in shock, all right? So let's summarize. Let's see where we're at. Where's Bob at now? Well, we did leave him in the ER, okay, and we had his blood drawn. Remember, we checked his complete blood count. We checked, basically checking for blood loss. That is, that C right there is complete blood count. And we're checking for his blood loss, and we notice it was very low, right? We also noticed that his kidney function test, his BUN and creatinine were high because they weren't filtering, so he was in shock. And we also checked out the blood bank, in which he got 4 of these right here. This would be O, this is how it's labeled, O or A or AB AB, Bob ended up with 4 O units, so it would have an O right there, and they attach it to his IV. And they give him units of blood because he's in shock. His blood volume has dropped. Blood pressure has dropped, and he's on his way out. So they hook up the blood, and they can do this even while they're in surgery. So setup time is very critical. If you're too slow, Bob will die. If you're fast but you're not accurate, you give him the wrong type, Bob can die. So it's a very, very important area. I keep saying that, I know. So, but where's Bob at now? Where'd he go? He went to surgery. Bob's in surgery, and there he meets the doctors and the nurses, you know, and, but they removed his spleen. What? Can they do that? Yes, they can. It's one of the organs you can actually live without. Who knew, right? So his spleen is taken out. Because all the blood is being let into his abdominal cavity. There we go. And the organ or any tissue, let's just say tissue, any tissue that is taken in surgery is then sent to the histology lab. Now, histology is part of that other clinical area I talked about. It's called the anatomical laboratory, okay? And histology, this guy right here, he was looking over Bob's spleen and noticed a nodule. He then contacted the pathology assistant, and they looked at it, and they decided to look at it further. Okay, they probably consulted a pathologist in the meantime, and he's reviewing. It looks like he's maybe embedding some things right there on as well, but he's reviewing it, and they're going to look at it further. Okay, so we're going to be talking about histology. This is something else. Move me down there. This is something else that this area of interest is part of the biomedical laboratory diagnostic program. It's a path that you can take. Some of our students actually take histology and medical laboratory science, so they do both in this program at WVU. And you can make around 53,000, like I said, you know, ish, give or take, and it is a bachelor's degree. Okay, now this right here is not the spleen. Okay, it's just a picture, and I wanted to kind of give you kind of an over-round look of it. But the spleen would have went through what they call grossing or dissection, and they put them on these cassettes. And basically what they want to do is get out all the water that they can and replace it with paraffin wax. Oh, you guessed it, histotechnologist. And what this wax is, see this mountain right here of wax, and what they wanted to do is support it, and they want to preserve it. It's very important that, that you preserve the specimen, mount it in wax, and to try to keep it from degrading, and so that we get you want to keep it as close to the real thing as you possibly can. Okay, you don't want it to deteriorate. That's the word I wanted going for there. You don't want it to deteriorate, so you have to fix it, which means you preserve it. You embed it in wax so you can make these mighty fine sections of it, and then you put it on a slide, and then you stain it. Notice in this staining process, depending on the cell and the stain, they take up the stain differently, okay? Notice this cell right here where my pointer is at is different than this group right here, which is different than that group. So you can tell if there's any growths or if anything is malign there, okay? Move me up there a little bit. And you can see this pretty slide right here. You can see the difference. That way you can see, you know, different areas of the tissue and determine what's, you know, maybe benign or actually what is cancerous or what is normal, all right? Another picture of some staining, all right? This is what it looks like on the slide. And then under the microscope, this amplifies everything, and then they can actually look at it. So basically, they could tell that if there's a growth or cancer right there. Well, they want to go a little bit further. Oh, yeah, but wait, cancer, we're not sure about Bob, so we have to send his specimen off to a molecular biology area. Now, not all laboratories have a molecular biology area, okay? Some of your reference labs would, but you know, your larger hospitals would, labs have them. And down here, they send the patient's tissue here. It is run on a mass spec, and they can look at different proteins. Now remember that cancer, if it's not working, it's not producing any protein, you know, so they can tell because it'd be missing a peak here. Or if it's an abnormal protein that may be a higher protein or a higher peak than what it should be, it may be a missing peak. Anyways, they compare it against what they already have of a normal tissue inside the mass spec, so they can see the difference between the two. Then also it goes off to the genomics laboratory where they do genome sequencing, and they can tell exactly what gene is causing the problem. Pretty cool, huh? Another area, another test, and it is also done, and it can be done at WVU, is polymerase chain reaction, where you take a base pair and you amplify it all the way up, and then you can review it, okay? Here's the DNA, the double helix. It's in the chromosomes here. And in our program, in the biomedical laboratory program, actually next year, our one of our professors is going to be teaching molecular biology, and we'll be doing this very same testing, okay? Very interesting molecular work. I'd like to point out that these are our students, and they're working on their, probably more than likely by the look of the slide over there, they're in hematology lab, and they're looking at CBCs, okay? The cells, you can see the red cells there in the background. So I'm gonna guess that's what they're doing. But this is our group. And then another of our group is in histology, okay? And let me move my base out of there. And you can see they're doing different areas of histology, and at different stations, they're performing different tasks and of staining, embedding, and evaluating the final product there. And also that West Virginia is the Pac-12, okay? And if you're interested in football, it's really fun to follow college football, okay? Biomedical laboratory is we have that at the WVU, and with that, in that area, in that program, is histology, okay? You can, like I said, get a job right after or even before you get out of school. And so you're not guaranteed, but your chances are extremely good to actually have a job before you get out. And then if you want to work for a while, or you just want to go on for more education, you can go right on to med school, dentistry. We even at WVU in our area have a pathology assistant program. It's our graduate program. And we have forensic science there. Also, you can go on and get your PhD. We have a professor who teaches in our biomedical lab program that actually went through the very same program, came back, and is now teaching as a PhD. So he likes to teach, and he's done research in cancer research. And so there's plenty of opportunity to go on and do different things. So that's about all I have for you. The rest of it, oh no, I have one more slide, okay. Here's a retreat that our students were on, and someday we would like to see you at this retreat as well. And then I want to point out the different image references and lots more. As you can see, I was kind of busy. All right, well, take care, and I hope to see you soon. All right, take care.